What if I told you that a single dose of a substance found in mushrooms could permanently change your brain, end decades of depression, and make you feel more connected to the universe than you ever thought possible? What if I told you that scientists at the world's most prestigious universities are now saying this isn't just possible, it's measurable, repeatable, and about to become the future of mental health treatment? Welcome to the psychedelic revolution. For over 50 years, substances like psilocybin and MDMA were locked away, classified as dangerous drugs with no medical value, relics of a counterculture that society wanted to forget. But something extraordinary is happening right now in 2025. These once banned substances are on the verge of FDA approval, backed by billions in research funding, with clinical trials showing success rates that make traditional psychiatric medications look almost primitive by comparison. We're witnessing a paradigm shift in how we understand and treat the human mind. Let me take you back to where this story really begins. The 1960s. Psychedelic research was thriving. Scientists were exploring LSD and psilocybin as potential treatments for everything from alcoholism to end-of-life anxiety. Early results were promising, sometimes miraculous. Patients who had suffered for years reported profound relief after just one or two guided sessions. But then the Cultural Revolution happened. Psychedelics became symbols of rebellion, anti-establishment sentiment, and recreational excess. The backlash was swift and brutal. By 1970, these substances were classified as Schedule I drugs, the same category as heroin, deemed to have high potential for abuse and zero medical value. Research ground to a halt for decades. What the world lost during those decades is staggering. Imagine if cancer research had been banned for 50 years because chemotherapy drugs could be misused. That's essentially what happened with psychedelic medicine. But some researchers never gave up. They kept pushing, kept asking questions, kept believing that these substances held secrets worth discovering. And now, finally, the scientific community is listening. Johns Hopkins University established the Center for Psychedelic and Consciousness Research in 2019, backed by $55 million in funding. It was the first research center of its kind at a major university in decades. Yale followed suit with their program for psychedelic science. New York University launched its Center for Psychedelic Medicine. Stanford, UCSF, Harvard, all the institutions that define modern medicine, they're all in. And the results they're finding are nothing short of revolutionary. Let's start with psilocybin, the active compound in what people call magic mushrooms. In clinical trials for treatment-resistant depression, depression that hasn't responded to any conventional treatment, psilocybin-assisted therapy is producing remission rates of 58% at the 12-month mark. Think about that for a moment. More than half of people whose depression was considered untreatable are experiencing lasting relief from one or two supervised sessions. Traditional antidepressants, which people take daily for years, achieve remission rates around 30 to 40%, and that's for standard depression, not treatment-resistant cases. A recent study published in October 2025 from NYU looked at cancer patients suffering from anxiety and depression, the kind of existential dread that comes with facing your own mortality. After receiving psilocybin-assisted psychotherapy, these patients showed significant reductions not just in anxiety and depression, but in obsessive thoughts, anger, and physical symptoms of psychological distress. The improvements lasted at least 6 months. One dose, 6 months of relief for people who had tried everything else. But here's what makes this even more fascinating. It's not just that psilocybin makes people feel better. It fundamentally changes how their brains work. Brain imaging studies show that psilocybin disrupts what neuroscientists call the default mode network, a collection of brain regions that become active when we're not focused on the outside world, when we're lost in thought, ruminating, reinforcing the same mental patterns we've had for years. This network is where your sense of self lives, where your ego resides, where depression and anxiety create their endless loops. When psilocybin enters the brain, it acts on serotonin receptors, particularly the 5-HT2A receptor, and creates a temporary state of what researchers call increased neural entropy. The normal, rigid patterns of brain activity dissolve. Regions that don't usually communicate start talking to each other. The boundaries between different brain networks become fluid. People describe this as ego dissolution, a feeling that the self you've always identified with simply melts away, and you experience consciousness without the constant narration, judgment, and fear that normally dominates your thoughts. This isn't just a subjective experience. Researchers at Johns Hopkins can measure it. They can watch on brain scans as the claustrum, a region believed to act as the brain's conductor, orchestrating attention and binding consciousness together, becomes significantly less active under psilocybin. The result is that feeling people describe of being connected to everything, of understanding something profound about existence that can't quite be put into words. And somehow, this experience, this temporary dissolution of the self, creates lasting changes in how people relate to their depression, their anxiety, their addictions. Studies on personality changes are equally remarkable. A January 2025 study in the American Journal of Psychiatry found that people with alcohol use disorder who received psilocybin therapy showed lasting increases in openness, decreases in neuroticism, and significant reductions in impulsivity and depression. These aren't temporary mood boosts. These are fundamental shifts in personality traits that typically remain stable throughout adult life. Psilocybin appears to reopen what neuroscientists call critical periods, windows of heightened brain plasticity that normally close after childhood, allowing for rapid learning and adaptation that shouldn't be possible in adult brains. Then there's MDMA, better known by its street name, ecstasy. For years, it was the poster child for dangerous party drugs, but in controlled clinical settings, MDMA-assisted psychotherapy is achieving something unprecedented in the treatment of post-traumatic stress disorder. In clinical trials with veterans and first responders, people suffering from PTSD so severe that many couldn't function in daily life, MDMA therapy produced lasting symptom relief in 71% of participants at the 12-month follow-up. 71%. For context, the best outcomes with traditional PTSD treatments hover around 40%, and that's with ongoing therapy and medication. What MDMA does is elegant in its simplicity. It floods the brain with serotonin, dopamine, and oxytocin, creating a state of openness, trust, and reduced fear. But more importantly, it temporarily dampens activity in the amygdala, the brain's fear center, while enhancing activity in the prefrontal cortex, the region responsible for rational thought and emotional regulation. This allows patients to revisit their traumas, to process memories that were too painful to touch without being overwhelmed by terror. They can finally look at what happened to them, understand it, integrate it, and begin to heal. The therapy sessions themselves are carefully structured. Patients undergo preparation sessions where therapists help them set intentions and build trust. Then comes the dosing session, which lasts 6 to 8 hours. Patients lie on a comfortable couch, wear eye shades, listen to carefully curated music, and journey inward with 2 trained therapists present the entire time. The therapists don't interpret or analyze, they simply provide a safe container, occasionally offering support or guidance, but mostly allowing the patient to have their own experience. Afterwards come integration sessions, where patients work to understand what they experienced and how to apply those insights to their lives. This is crucial. Psychedelic therapy isn't just about the drug. The therapeutic context, the set and setting, as researchers call it, is absolutely essential. People who take these substances recreationally, without preparation, without trained guides, without a therapeutic framework, they might have interesting experiences, but they won't get the same therapeutic benefits. In fact, they might have difficult, even traumatic experiences. This isn't about taking mushrooms at a music festival. This is serious medicine being administered in clinical settings with extensive safeguards. And the safeguards are necessary. Psychedelics are powerful. They can trigger temporary anxiety, paranoia, disturbing visions. For people with certain psychiatric conditions, particularly those with a personal or family history of psychosis or bipolar disorder, psychedelics can be dangerous, potentially triggering psychotic episodes that require medical intervention. This is why legitimate research happens in controlled environments with medical supervision, screening out high-risk individuals, monitoring vitals throughout sessions, having protocols in place for psychological crises. Critics rightfully point out that we still have questions. Most studies have relatively small sample sizes. Long-term data beyond a year or two is limited. We don't fully understand who will benefit most or what predicts a good outcome versus a difficult experience. There's concern about creating unrealistic expectations, about people thinking psychedelics are magic bullets when they're actually tools that work best within a larger therapeutic framework. There's worry about commercialization, about companies rushing to market without adequate safety data, about recreational users misinterpreting research findings as permission to self-medicate. These concerns are valid. Science takes time. Rushing toward legalization or widespread use before we fully understand the risks could cause harm. But here's what we know right now in 2025. The pharmaceutical company Compass Pathways completed phase 3 trials for their psilocybin formulation in treatment-resistant depression. It met its primary endpoint. A second trial is due in mid-2026. Atai Life Sciences received breakthrough therapy designation from the FDA for their psychedelic compound, with phase 3 trials starting in early 2026. AbbVie, one of the world's largest pharmaceutical companies, paid over $1 billion for the rights to a psychedelic depression treatment. This isn't fringe science anymore. This is mainstream medicine. The momentum is building in policy as well. Over 36 psychedelic-related bills have been introduced across more than a dozen states since the beginning of 2025. Oregon has already legalized psilocybin therapy in licensed facilities. Colorado followed. Connecticut's House of Representatives passed a bill to decriminalize possession of small amounts of psilocybin, though it stalled in the Senate. The conversation has shifted from whether these substances have therapeutic value to how we can provide safe, legal access to people who need them. But let's zoom out for a moment and ask a bigger question. Why do psychedelics work? What is it about these compounds that allows them to do something conventional treatments often can't? The answer might lie in how they address the root of psychological suffering, rather than just managing symptoms. Most psychiatric medications work by adjusting neurotransmitter levels. SSRIs increase serotonin availability. Benzodiazepines enhance GABA activity. These approaches can reduce symptoms, but they don't necessarily change the underlying patterns of thought and behavior that drive mental illness. You take them every day, and when you stop, symptoms often return because nothing fundamental has shifted. Psychedelics work differently. They create what researchers call a critical period of enhanced neuroplasticity, a window where the brain becomes exceptionally malleable. Old patterns can be disrupted. New connections can form. It's like the brain gets a chance to reorganize itself, to escape the ruts it's been stuck in. And when this happens in the context of therapy, when insights and realizations emerge during the psychedelic experience and are then processed and integrated with a trained therapist, those changes can become permanent. There's also something profoundly important about the mystical experiences people report. Studies consistently show that the intensity of mystical type experiences during psilocybin sessions, feelings of unity, transcendence, sacredness, correlates with therapeutic outcomes. People who have these experiences are more likely to show lasting improvements in their mental health. This has huge implications. It suggests that addressing mental illness might require more than just fixing brain chemistry. It might require experiences that fundamentally shift how people understand themselves and their place in the world. This raises uncomfortable questions for a scientific and medical establishment that has spent centuries trying to reduce human experience to mechanisms and molecules. How do you study transcendence? How do you measure the therapeutic value of feeling connected to the universe? How do you put that in a clinical trial protocol? Yet the data keeps showing that these subjective, ineffable experiences matter. They might matter more than anything else. We're also seeing applications beyond depression and PTSD. Researchers are exploring psychedelics for obsessive-compulsive disorder, eating disorders, substance addiction, cluster headaches, even Parkinson's disease. A Yale neurologist named Emanuel Schindler has been studying psilocybin for cluster headaches, sometimes called suicide headaches, because of their excruciating intensity. Patients have been using low-dose psychedelics to manage these headaches since the 1990s, discovering through trial and error that it works when nothing else does. Now science is catching up, trying to understand the mechanisms, optimize the protocols, and bring this folk knowledge into legitimate medicine. There's discussion of developing non-hallucinogenic versions of psychedelics that could provide therapeutic benefits without the intense subjective experience. Some researchers believe this would make the treatments more accessible, easier to integrate into standard medical practice. Others argue that the experience itself is central to the healing, that removing the psychedelic component might eliminate what makes these treatments uniquely effective. It's a debate that will likely continue for years. What's clear is that we're at the beginning of something significant. The psychedelic renaissance isn't just about bringing back drugs from the 1960s. It's about fundamentally rethinking how we approach mental health, what we consider valid medicine, and what it means to heal. For decades, psychiatry has focused on symptom reduction, on making people functional, on returning them to baseline. Psychedelic therapy aims higher. It seeks transformation, not just management. It asks whether we can help people not just feel less depressed, but actually change their relationship to life itself. The personal stories are what make this real. Patients who hadn't smiled in years, crying tears of joy during integration sessions, finally understanding that they're not broken, just hurt. Veterans who couldn't sleep without nightmares waking up refreshed, the weight of trauma finally lifting. People who spent decades in the prison of addiction walking away free after confronting the pain they'd been trying to escape. These aren't abstractions. These are lives changed, families reunited, futures reclaimed. But we have to proceed carefully. The history of medicine is full of treatments that seemed miraculous at first, only to reveal problems later. Psychedelics have been used for thousands of years in indigenous cultures, but those traditions developed complex protocols, social structures, and spiritual frameworks around their use. We're trying to extract the medicine from those contexts and put it in Western clinical settings. That translation isn't always clean. We need humility, ongoing research, transparent reporting of both successes and failures. We also need to address access. Right now, psychedelic therapy is expensive, often costing thousands of dollars for a treatment series. It's available primarily to people who can afford to participate in clinical trials or pay out of pocket at the few legal facilities that exist. If these treatments get FDA approval, will insurance cover them? Will they be available to the communities that need them most? Or will this become yet another example of cutting-edge medicine that only the privileged can access? There are questions about training therapists. Facilitating a psychedelic session requires different skills than traditional talk therapy. Therapists need to be comfortable with non-ordinary states of consciousness, able to provide support without imposing their interpretations, trained to handle emergencies. We need curriculum, certification programs, supervision structures. We need to scale up the workforce to meet demand that could be enormous once these treatments are approved. The future might look very different than we imagine. Maybe psychedelic therapy becomes a standard treatment, something your psychiatrist can prescribe, covered by insurance, available at clinics in every major city. Maybe it remains specialized, reserved for treatment-resistant cases, administered only at certified centers with extensive screening. Maybe we develop better versions, compounds that provide the benefits with fewer risks, protocols that maximize outcomes while minimizing difficult experiences. Maybe we discover that psychedelics are tools for more than mental illness, that they have applications in creativity, problem-solving, end-of-life care, spiritual development. What seems certain is that we can't put this genie back in the bottle. The research is too compelling. The results are too dramatic. The need is too great. Millions of people suffer from mental health conditions that don't respond adequately to current treatments. If psychedelics can help even a fraction of them, the moral imperative to make that help available becomes overwhelming. We're living through a moment when ancient medicines meet modern neuroscience, when consciousness research intersects with clinical psychiatry, when mystical experiences can be induced and studied in laboratory settings. It's weird, it's challenging, it's uncomfortable for a materialistic worldview that wants to reduce everything to chemistry. But the evidence keeps accumulating. Something remarkable is happening in those 8-hour sessions in padded rooms with eye shades and carefully selected music. Something that can't be fully explained by receptor binding or neurotransmitter release. Something that participants struggle to put into words, but that changes them in ways that last. The psychedelic revolution isn't coming, it's here. The question now is how we'll respond, how we'll integrate these powerful tools into our understanding of healing, how we'll make them available safely and equitably, how we'll balance scientific rigor with the inherently subjective nature of consciousness transformation. The answers will shape the future of mental health care for generations. If this journey into the frontiers of consciousness and mental health fascinated you, hit subscribe to explore more of what science is discovering about the human mind. Drop a like if this changed how you think about mental health treatment, and comment below with your city. I'd love to know where in the world you're watching from.